morning, everyone, and welcome to the Institute of African Advancement Facebook Live. And today our topic is challenges associated with COVID-19 for Africans in Nova Scotia. My name is Sabrina Hussein, and I'll be your moderator for today. And here are panelists. On my right, we have
Sonia.
And on my left, we have
Praise Mugisho.
Okay, so we have a few questions to go through. And I guess our first one will be, what are some of the most challenging issues that some people in our community have been facing as a result of COVID-19? So, Praise, what can you tell us about it?
Actually, challenges are so many, but we were just trying to come up with few of them, some of them. So the first one is the lack of knowledge and education. First of all, the language barrier in our community, the majority of newcomer and African community, the information is given in French or in English. And then there is a barrier there, people are not receiving information as they should. And then we do have as well job uncertainty because a lot of people just got laid off from their job. And then others until now, they are not even sure based even on the second wave if they will be keeping their job or not.
Okay. Anything, Sonia, on it?
Yeah, just to add on that, I'd like to add about mental health because it has just brought up a lot of issues with people's psychology, like the way they think and the way they act during this COVID-19. They don't have to get out anymore. They are all indoors. And it's really hard, especially for the newcomers who want to integrate themselves in the community. So it's literally like not working well with their psychological mind.
I would like just to add another thing is the technology issue as well, because so much information is given like through technology, and then there is a lack of knowledge as well using digital stuff, and it has been affecting the African community so much.
Okay, no problem. So we'll move on to our second question, which is, how would you rank the response of Nova Scotian government to these challenges? What is good and what could be better? So, Sonia, would you mind starting with this one?
Yeah, sure. I'll rank it 8 out of 10 if we're ranking it, because they made sure that they provide free transit for the people during all this pandemic, and a lot of people who did not have transportation did not have to think about how are they going to pay the transit, how are they going to displace themselves. And another one that I found so important was the financial aid. We all know during the pandemic, a lot of people got laid off. A lot of people lost their job. A lot of people didn't want to go to work because they were infected with the virus. But the government made sure that they provided, I think it was the CR or something. And then it really helped big time with the people. So I think that was really, really important. The government did it thing. It helped.
My rank will be similar to Sonia's actually, because we can just say the public health authority have been doing an amazing job with the 811 number to call, and they try to understand everyone and try to serve the community as much as they could. And actually raising awareness as well. We saw at the library, we saw posters everywhere like symptoms, social distances. And the non-profit organization tried to support the different community members and churches as well, the food bank. So the support was really sufficient.
Yeah.
Okay. So when it came to the rank, both our panelists ranked the Nova Scotian government 8 out of 10, which is pretty good. So that means, as you can see, we've been doing pretty good with this pandemic, and people are safe and they feel safe in our province. So our third question will be, how COVID-19 affected children and young people in our community. So Praise, if you don't mind starting with this one.
That's such a nice question. I will say, first of all, is restricted knowledge when it comes to homeschooling, because the majority of parents, they still have a hard time understanding how really to support their kid when it comes to homeschooling. And then using the technology and digital stuff, it was really such a burden to the majority of parents. And lack of socialization as well. The indoor stuff, kids were not allowed to go outside and play as they used to. And the lockdown, such as recreational centers, it affected not only young people and children and youth, but actually even parents as well.
Yeah, that's pretty much sum up a lot of things. And I also feel like the pandemic and all this homeschooling, just to add up on what she said, it's also added on the increase of screen time. Like you find a lot of children, especially the young generation that we are in, we used to be too much on the screen, but now it's like a lot. We are now a lot on the screen because of the homework, the stuff that we have to do on screen, and that also brings other stuff like eating disorders. Like you're bored, so you just start eating. You just start eating, and you're on the screen, which like it just messes up a lot of people' physical health. And I really think the big thing is just like the screen timing became more, and I feel like a lot of people are gonna fall to be victims of this because the screen time will also result to eye problems apart from the eating disorders, which just bring up another problem to another problem. So I feel like that was one of the problems and the challenges that we faced as the young people in the community.
I just want to add up a little bit when it comes to finances actually, because since schools have reopened and now kids are being denied to be bringing their cultural food as an African children, and then it have added a match on the finances on parent because you have to start giving the menu and the order like 2 weeks ahead, and you have to spend like $95 after 2 weeks, and then there is that job uncertainty, and then there is that financial barrier which is right there. And for example, if it's a family which have 5 or 4 kids at a primary school or kindergarten, that is too much. Another thing, and I would say as an African, racism as well, because we could see when you were walking on the street, like people could see somebody and try to go far away, and then you feel there is an insecurity in the community.
And just like on the food part, a lot of the newcomers, also like the African newcomers, they don't know yet the Canadian food. They're still finding it hard, at least I know on my side, they're still finding it hard to find out which food is better for their children because they're just from Africa. So the food from back home and here it's so different. So that's a little bit challenging for the children because they don't really know what exactly they want. The parents really don't know which food exactly they should give their children. But when we used to just go to school and your own food was packed, you had your own African food, so you're just used to the food that you're eating. But now it's a little bit different and hard.
Okay, there's one point I was thinking of, and maybe one of you could expand on it, is when it comes to studying at home, homeschooling. How do you think like newcomers and African parents and immigrant parents manage that when they are not used to the same school system as it was back home? What can you say about this?
I think we can all agree it's hard and it's still hard on them because, as I mentioned earlier, the curriculum is different. Everything is just different, and I feel like this is a lot weight on them. This is a lot on them, and it would be good if something is done to help them out because I feel like it's a lot, really a lot. Not only on the children, but also on the parents, especially the parents.
Actually, it's not that they did not try. They tried, but a lot of parents felt really powerless because when it comes, there is already that language barrier, and then when it comes to explaining your kid whatever they're doing, and then you are not really capable of doing that in English or in French, like there is that power dynamic which raises up right there. And then you feel the parent is on a position where he doesn't know what to do, and it's add up on the mental health.
Okay.
Definitely.
When it comes to children and young people, what do you think the parents should do to educate them more on this situation and this pandemic?
I think raising awareness is something really good, and keep repeating and repeating. Don't give up on the routine, because as a young people, like there is that selfishness, and you're like, no, you guys are just taking it too much, or you are trying to overwhelming. But what is true, COVID is out there, and it's true, and we need to respect the social distances and the measurement with the public health is trying to give out.
Definitely. So we're going to move on to the next question, and this question has been something that started to be talked about a little bit more these days, especially with this pandemic, and it is on the topic of mental health. So the question is, what are mental health challenges that have come up in result of COVID-19? And if you don't mind starting up with that, Sonia.
Definitely. Schooling, like stress. When you're, especially for university students, this is like something that I just wanna like raise. It's personal. It's the fact that you have a lot of assignment, you become your own prof, and you become the student. So it's like it raises a lot of stress, and sometimes it's just too much, and you just don't know how to handle it. It's a lot, and stress is not only because of school or something, but then you don't get the chance to go out and see people that you used to talk with, so it becomes really hard socially and mentally. It's just coping up. It's really hard, especially during this time when you're just like, it's the first time this has ever happened when you're the teacher and you're the student, so it's like it's not really working. Not on my side, at least I know.
Perfect.
Actually, I will add depression. As in African community, we do have that strong bond of relationship, like going to one place to another and celebrating together. But during this COVID-19, with all the restriction which was out there, you felt like you were surrounded only with your family members. And then if it's not that, you have to call maybe back home, and then it's question they're asking the same question you are having, so you don't know what to reply and you don't know what to deny because you are indoor, you don't know exactly what is going on out there. And I would just say anxiety as well, because every time you are trying to do grocery going outside, you are insecure, you are not sure if you will be having the COVID, or you will bump to somebody who has it already. And then there is that insecurity, mental insecurity, because for everything you do buy, you have to wash, you have to be aware. And then especially when it's mail, what to do with mail in the postal office, like postal code, all that stuff. And actually talking about college and university, in one household when you're like 5 and your parents as well have to attend, maybe it's an English class or it's an online class, so you have to orient your parent how to do it. And then if it doesn't work, other people doesn't mind that you're in class, and then you have to concentrate as well, for sure.
Siblings too will be calling you now.
Exactly. I'm not missing that. Exactly. So, by like when you are trying to give an offer to if either your sibling or your parent, you're missing. Because the professor doesn't care if you're online or not, because your name is pumping up, so he knows you are there. And then you realize it's too much, it's a lot of burden on you, and you don't know how to deal with it. And you cannot complain because everyone is telling you the same word, it's pandemic. We have to cooperate, it's the pandemic. So I feel it brings a lot of depression. it really brings a lot of depression, actually.
Well,
Yeah, a lot of stress. Well, for a fact, I know that when I get stressed, what I like doing is probably go outside, take a walk. When I know there's not going to be busy outside, take a little walk, some fresh air. What are some of the stuff that you guys have been doing to cope up with the stress of this pandemic?
on my side, personally, because most of my friends travel, so that like a lot of people went to their home country because of the pandemic. So walking was just, I don't know, walking was one of the things that I would like to do, but I feel like I just go to the park and just sit. I just sit and get the fresh air but now it's cold outside. How am I going to go outside in the park alone in the cold and sit? I used to, one of the things that I found that it really helped, I read it in an article, it's like when you're stressed and you feel like you're overwhelmed, close whatever you're doing and just do some other thing that makes you happy. Maybe, I don't know, watch Netflix, do other things apart from walking if it's bad outside. So I'm going to try and do that a little bit.
Yeah, maybe learn something new, play some music,
Thank
learn
you.
an instrument. What about you?
Actually, it's weird and funny because at the beginning I was happy. I was like, I'm gonna be indoor. That's cool.
Introvert.
Like, yeah, that's cool. And then after 1 week, I feel like it's overwhelming. I cannot do that. I want to go outside and have fresh air. And then, without forgetting that all the parks were shut down, right? And then there were nowhere to go. And there were indoors activity, but it reached a point where I couldn't do it anymore because it was already familiar. I know how to play this game. I know how to do this. So what should I do? And then you take a look. There was no library which was open, so I can go and borrow a book. That is one. And then I was having that feeling of being afraid. I don't want to order something on Amazon because there is all that scenario and routine. It may reach here and then there is a COVID on that package. What will happen? So it got like, it was too much. So glad I am. Now it's cold. And like we are allowed to go at the park, and some libraries now are open but with restricted time. And actually it's really nice because we can gather together but not more than 10 people or 20 people. So we are going back, we are taking one step at a time.
Everything you can add. Pray when you're bored. Pray.
Pray
at home. Pray at home. Bring your African culture out.
Exactly.
Pray. Sit home. Pray.
Read the Bible.
Pray. That's like a thing. Like when you stress, pray. Sabrina, pray next time. Don't go for a walk. You pray.
Pray.
Definitely. So guys, don't forget to deal with the stress. Praying. There we go. Physical exercise. Take a fresh air. Learn something new. Keep up in contact with friends and family, whether it be online or not. Be mindful though of your distance and everything that has to do. Keep yourself safe.
Actually, thank you for talking about learn something new.
Yeah.
Like, a lot of people did take advantage of learning something new. There was like a free teaching of how to sew masks. They did.
Definitely.
Like, and maybe a class on how to cook or something, and even relationship, like family relationship, it's really improved. Yeah, exactly, because you are all stuck in the house, so there is no more excuse. I have homework to do at the library, so
yeah, definitely.
Sometimes they say too much of everything is bad.
Yeah, there we go. You guys know it. So we're getting to one of our last questions. So is there anything you think the African community could do better to support families in our community? So with that, Sonia, if you don't mind starting on it.
I'll say raising awareness more about it, and in educating and keeping contact, educating the African families about how to keep up with the washing hands, wearing masks in every language they could, because most of these informations, they're in French and in English. Not every newcomer, not every African country speaks French and English. So the most African communities, for example, this one, the Institute African Advancement, could help with the provision of maybe templates that talks about continuing wearing masks, washing your hands, keeping the social distance in every language possible they could, so that everybody felt included and also feel like they're not being set apart as a different person. Yeah.
And so with that, let's talk a little bit more about the Institute of African Advancement. So Praise, tell us more on what your organization can do for our communities.
We can do tremendous things for the community. Actually, Afro Institute is located in Halifax on Quimper Road. For the one out there in Halifax who doesn't know where we are on Quimper Road. And during the COVID, we tried to support our community by doing the food distribution. So we went door by door and we did that one. And then we were trying to shout out videos on awareness on COVID, what to do in the majority of African language spoken in the community. So we did one in Swahili, another one in Somali, so different, and even in French and English. And we haven't stopped yet to do webinars on health practices during COVID-19 with different community members in different languages as well. And we try to bring up such as this topic, challenges which African community are facing here in Nova Scotia, as well as Sonia spoken, translating information on COVID on templates or when it's out there, 811, what to do, like what step does follow as well. And I would say giving emotional support as well, because somebody may call or somebody is affected with the disease. So we need to understand that person and see how we can step in and help him emotionally while respecting the restriction as well. And we also have some community, I would say community gathering, but it's not that much. But we are trying to protect and preserve the African culture value during this pandemic season.
Okay, definitely. Those are great points, and for everyone watching out there, you're more than welcome to come see them on Quinpo Road, and you can check out their address online and you'll find it there, that's for sure.
Talking about online, actually, like we are on Twitter, on Instagram, all the social media platform, so you will find our file on there.
Okay, great. So is there anything you guys want to add on the topic of COVID-19? Anything that you might think will be useful for the people out there watching us today?
The only thing I think I can add is that, apart from what we have already mentioned, is that we can all agree that COVID is hard. It's still hard. It's a worldly pandemic, and everybody is still coping up with how to survive in this thing. This thing has never happened before. It's like from the world history. So it's not only hard on everybody, but also on our culture. When I mean our culture, it's like, apart from the fact that we're in a different culture, it's also add a little bit of a burden on African culture, because not only you need to cope up with the new place you're in, you also need to cope up with the new rules that they're coming up each and every day. So I feel like people just need to accept the thing that we are in, the pandemic that we are in, and allow every single rule that comes and just respect it, because we all need to survive. This is all I can say. And just keep calm.
Yeah,
Keep calm.
Anything else?
Oh, so I want to thank participants out there, and feel free drop in your question, and then we still have time. We can answer those questions. As right now we are waiting for the second wave. It's out there already. I just wanna raising more awareness in African community that COVID is real and is out there and is killing. And then maybe let us try to stop our myth and those stuff of it doesn't exist. I don't need or I don't have to wear a mask. And let us try to drop the percentage of parties or big gathering. Let's just try to respect the public health regulations and policy to save our community members or to save even your family members as well. And let's try to support each other by the time we know somebody is affected. Let's try to offer him an emotional support. Do not reject that person or do not point fingers, but let's try to empower each other and raise more awareness when it comes to parents. Do not get tired with youth. Keep on repeating the same stuff every day. Wear your mask, wash your hands, respect the 6 feet social distancing. And I would say the last one, and let's try to call the number in case you got one symptom among 7. Just call 811 and they are ready to help you.
Okay, those are really great points. Before we end it, just a little reminder, don't forget your social distancing, wear your mask, keep mindful of the symptoms you might get, educate yourselves and your family and your friends too, and make sure that if you feel anything, like she said, 811 is there to help out. You can call, or if not, if you're more of a tech savvy person, the Nova Scotia Health Authority has a little questionnaire there that you can answer online, and you can find out if it is a necessity for you to call 811 or go to the nearest clinic. So as Africans, we love to be there for each other. So let's be there for each other on this one too. COVID-19 is real and it's still there. So let's be mindful of each other. Let's be our brother's keeper. Okay? So
Bring it out.
yeah.
May I add something on
Yeah.
that? Actually, even there is amazing service providers organization out there in Halifax. Like we do have ISIS, we do have YMCA, we do have Adam, we do have AFA as well. We do have. There are so many. There are really so many.
We're out
and
there.
They are exactly.
We're out there. We're here to help.
Exactly. So let's try to use all those venues and do not feel afraid to ask questions. There is no bad question, there is no wrong question and right question. And asking question is the better way to know and to get educated. So by the time you are being silenced, you are not killing only yourself, but you are putting your family life in danger as well, your neighbors and your community. So let's try to empower each other and let's keep the African flag high.
Exactly.
Amen to that. Well, for now we're done with the questions. So if there's any questions from the public, this is the best time for you to shoot them, and we'll be here to answer them. Three of us have, a bare minimum enough knowledge to try and,
And also and contribute
Yeah.
some of those things. Yeah,
definitely.
Yeah, we can follow us, right?
As we are waiting for questions.
Yeah. So obviously, like, sit here. We allowed to conversate, right? We're waiting for the questions.
No, we have to bring something like talking about language barrier as we are waiting the question.
Okay. Yeah, I would like to add that actually about language barrier, and
Okay.
not only as Price mentioned about, when she mentioned about schooling at home, if you're like 5 in the house and you're like waiting for your class, and your parent, you need to help her with, and like, or him on a different class that they are attending, because they are also attending. So I feel like most of the young African community, young people in the African community became the psychiatrists of their own parents, because they started doing stuff for their parents. No one else is there. Everything is closed. And if you want to have an appointment with your doctor, for example, you need to take a long waiting list, So it's really a challenge that I feel like it got weighed on the young people, and they also have their own classes, and it's home. There's no way you're gonna tell your African parents that. Wait a minute, I'm doing this. No, that's disrespectful there. Like, you need to stop whatever you're doing and go and help, forgetting that you have your own homework too. You have other things to do, but it is what it is. It's a new world we are living in. And about the medical help, yes, there were the free things, but then the waiting list became longer and longer and longer. Like, when you call right now, see the assured that you're gonna be received next month, because there are other people. So these are just like there are a lot of challenges which people have been facing, and a lot of people just, when they get the symptoms, I feel like they just don't mind anymore. They don't mind anymore going to the doctor, because they're like, what's the use? I'm gonna go and just wait for a long time, or I'm gonna go and they're just gonna tell me I have COVID even though I just have a little symptom. So they do have the symptoms, but they don't want to do it because they feel like it's gonna take long. So I feel like that's a low-key challenge there.
I would like to emphasize more on COVID
Screening?
Yeah, screening stuff.
Screening
Yeah, yeah.
interview?
Yeah, screening interview. I felt as if that one as well was a big challenge to the African community, because if I have lack of knowledge when it comes to technology, and then if I've been calling the 811 and they have put me on hold, and by the time I do reach out to them, they're like, okay, in the meantime, because we have so many calls coming in, do you mind do the screen interview of COVID? And with the language barrier, with the technology barrier, as an African person, by the time you just open your computer, you don't know where to go. like you don't know how to start and how to do it. So when it comes to yes, you may ended up doing no, and when it comes to no, you may ended up pressing yes.
So this point is about the you're talking more about the newcomer, the African newcomers in the community, or the African all at large?
Not only the African newcomer in the community, but even the African who are here. When it comes like to medical medical specific word, like there are those words which it's only somebody who have been working in the medical field who can understand what they are talking about, right? Like, but if they told you like how could you say your vital signs, so you will ask yourself, what is that?
The vital signs.
Yeah, what are you talking about? How is your temperature? Like, do you feel yourself hot or cold? So let's say if somebody who has been having that temperature, you are like always warm, and then it comes to that, how would you specify that? Like, you don't know what to say, you don't know what to expect. And a lot of people, maybe they declare themselves by coughing once or twice, I have COVID, and then they just get depressed more and more because nobody was there to help. Like, the line was there, it's true, and it did help, and thank you so much for public Nova Scotian help, because you did your best, that is true. But there always are a spot of improvement. And we are here just to specify and to point out those points of improvement and give value to everyone. I would say that for every little thing. We are not saying like they did not do best, they did their best, and without ignoring the demographic as well of people who are calling. Like on one line, maybe 100 or something, everyone is calling, but without ignoring the barriers which are out there.
Well, I have one question for you guys. Since you guys I know your family members and stuff like that, what are some advices you can give parents who have children that they go to our public schooling? What are some advices you can give them while sending their kids away from home, knowing that they're going to be out there with people that they're not sure if they have been affected with the virus or not? What are some advices you can give on that?
You know how I mentioned prayer before? Pray before they go. Just expect, I don't know, I mean, teach your children, as I mentioned, like make sure you repeat it. Let it be your new Bible. Tell them it is what it is. We're in the pandemic. Wash your hands, wear your mask, make sure you're 6, even though like you're at school with your friends. No hugging, no highs anymore. No, you just
no kisses.
No, that's not happening. But you just make sure your children know what we are in this together, and don't forget praying. Pray for them before they go, and expect for the best, because you cannot be their angel guide or whatever they go. You know, you have other things to do as a parent. So I feel like you need to just teach them, and they need to know what they're into. This year has been tough as it is, so just tell them. And when they go at school, make sure you have reverse masks every time they come. You just give them new masks, because those masks also need to be hygienical, because you don't need to have one mask every single. Exactly, so they need that. And make sure they stay away from people who are coughing. Even though they are friends, if you're coughing, stay away. It doesn't matter what you have. We don't know. We don't trust anyone this year. Yeah,
for
so I think that's a big thing.
If your kids are showing any symptoms or signs of the virus, please make sure they stay at home. Try to educate, even if they need to be isolated for a bit. Tell them that it's for the best for themselves and for the people around them, and just let them know that yes, you're in this together. You gotta be mindful of everybody around you, and that's how we're coping these days.
Yeah, actually, maybe we would ask parents not to panic too much, because like COVID is something that you cannot control, but you can try to prevent, but you cannot control that issue. Just keep on raising awareness, educate your kids, tell them like it's there, it's real, and take it easy.
Exactly. that take it easy part. Take
it easy.
One
No,
step at a time.
yeah, not putting too much pressure, because as a kid, if you were screaming on me and telling me every time, wash your hand, but we need to understand what is the COVID, what is it exactly.
That's for sure. So, good. So we have a question from one of our participants. What should parents do in terms of stress, mental health issue when it comes to dealing with COVID-19 and depression at home? So I think this is a very compact question, which I'm going to break down a bit here. So with stress and depression, what can you do at home to prevent that as a parent?
That's where we do call for physical activities, because it does help. And if we do remember, during COVID, it was close to spring, right? And as I know, with my little knowledge, gardening is an amazing way of like releasing the depression and the stress, and have a time to talk about it. Have a time to conversate with your family member. And as we spoke about the organization, service provider organization, there was always a line with a mental health person, and that person were there to help you, to ask you, how do you feel? There was always a follow-up. Until now, there is a follow-up. Maybe if you do miss the phone number, just try to inform you if that phone number is still there, because there were people in the community who were ready to support emotionally, physically, and mentally, like in all the way. And if it's when it comes to the kid, because I remember every time they could call, they will start asking, how do you do as a parent? How do you cope with your kid being indoor if they were always out there on the recreation center? And how do you do to sustain the family harmony and accommodation as well? So numbers are out there, and people are out there to help when it comes to depression.
And just to add on that, parents should also know what is mental health. I think that should be the big question, as that question said. Most of them, they don't even know the meaning. They need to be taught what is mental health all about, how can we cope up with that. So I feel with those baby steps, once they know what is mental health all about, they'll get to understand and recognize the symptoms once the children are starting to show them up, or themselves, because it's a new thing. As I said, it's a new thing. So once they know what is mental health and what is going on, what is mental health all about, they'll know how to cooperate with it, and they will know when to ask for help and to reach for help. As she mentioned, Express mentioned earlier about there's a lot of African communities in Nova Scotia, at least that I know of, including this one over here. They can help out. Once you start seeing the symptoms, once you start seeing that I am not doing well as I used to do before, I'm just lack motivation right now, I don't do these things, it's okay, this is a pandemic, ask for help. Don't wait for it to be late to ask, because it has really a big disadvantage on people.
And talking about how to prevent it, before preventing something, you need to know about that thing.
Yeah,
that's where we do call education has to come in. Because if you don't know what is depression and how somebody starts being depressed, you cannot know how you can prevent a depression. And being a parent, when you have started reflecting those symptoms, you need to know, is this depression, is this a stress, how can I overcome this so it doesn't go to my kids as well. So you need to know more, to learn more about mental health and depression for you to be ready, or for you to take guard how to prevent that depression.
Okay, and if you're feeling down and you feel like you need an actual professional help, I know in schools they have counselors. If not, there's a kids help phone. Yes, the name says kids, but it's for everybody, and I highly encourage everybody to actually go online. There's a chat room for that. If not, talk to your friends and family, tell them how you're feeling. Just by expressing yourself and like telling about your emotions, then you find a way to deal with them. So as we come to an end, I want to thank all of you who participated. I want to thank our panelists and the tech support and everybody. And please give us a thumbs up on Facebook, likes on our all other social media platforms, and With that, we're concluding our Facebook Live on challenges associated with COVID-19 for Africans in Nova Scotia with the Institute of African Advancement. Thank you, everybody.
Have a good weekend.